This is a point to be noted because our DNA is such that, it's kind of race specific. We will match with someone from our country only. Okay. It is very rare that we'll find a match in an outside country because our race is different. We are Aryans, Dravidians and all. American patients, Caucasians, Mongolians and all, we don't match with them. Yeah. So how does the stem cell work? I have collected 200 ml from the donor, but how does it help the patient? So the patient is usually, mostly a blood cancer patient, rarely a genetic blood disorder patient like a thalassemia patient, and some other rare blood disorders like aplastic anemia or multiple myeloma or some other disorder where the cells are going to help them. But what is happening is the patient is having blood cancer. So his bone marrow is faulty. Okay, so all the cells which are being formed in his body is coming from his bad bone marrow. So our first point is to destroy the patient's bone marrow completely with our medicines. So we'll take care of that. We'll give him a high dose chemotherapy and destroy his bone marrow completely. So we'll bring it down to zero. So what happens is these cells are also taking care of your immunity. So what happens is for the patient's immunity is also falling. So we keep it in a special bone marrow unit where, it's a very sterile atmosphere where the patient will not get exposed to anything for a few weeks. And the cells which are collected from the donor will be infused into the patient. Okay. So what happens is the cells are given to the patient just like a IV drip, and it will be taken up by the patient's body. Now that the patient is a perfect match with the donor, there will be no rejection. Okay, it will accept as its own because the DNA pattern is the same between the patient and the donor. So the acceptance is very high. And what happens is the cells they have the sensors in them. They'll go and sense that, this whole body is deficient of bone marrow. So they'll start roaming these cells into the bone marrow. They'll locate themselves. They'll sit there like a seed and they'll start forming new cells from there. So this 200 ml which has gone into the patient's body will act like a seed to start growing new cells. But what has happened is the donor cells are all normal. From now on, it will start forming all normal cells in the patient's body for the rest of his life, actually curing his cancer completely. So this is what is called, bone marrow transplant. Okay, in simple terms, remove the bad bone marrow and replace with a good marrow from the patient, and it will go and sit in the bone marrow forming areas of the patient's body and form new cells. Something interesting you would like to know over here is we don't need a blood group matching in this transplant. The patient and the donor need not match their blood group. So what happens is when we destroy the patient's immunity and the marrow, the patient's blood group is also nullified. The patient will start having the blood group of the donor. So A group patient has been transfused with an O group donor cells will become O group after a month. Okay, so you might find it interesting actually. So that is what is a bone marrow transplant, and within a month all the cells are replaced with these new cells of the donor, and the patient is having absolutely new cells in his body, absolutely new blood which is deficient of blood cancer. Okay, so he's having normal blood, so the cancer is eliminated from the patient's body. Yeah, so for the donor, absolutely a job well done. So what he did was priceless. A one-time donation of just 200 ml of blood has cured someone's cancer. But the donor had just had to walk into a blood bank, donate 200 ml, and he left the blood bank. We have transplanted and the patient is permanently cured. So you have extended the patient's life, mostly a small child, by many years, because 80% of our patients are children with blood cancer. And sadly, by the time the parents and the doctors reach out to us, it comes to the last stage of the cancer. But it is fortunate that a stem cell transplant can be done and even in the last stages, and we can offer a complete cure for them. So for the donor, he has not lost anything from his body. He has just donated blood and it will be replenished in no time. As you know, that injection has increased your stem cells by 20%. So on the day of donation also, we'll collect only that extra 20%. So even when you leave the blood bank, you're still 100%. So there is no loss to the donor at all. So of course, there is nothing, no gifts given to the donor as such, because he is doing something priceless. We cannot put a price tag on what he has donated. But of course, he can always live with the euphoria that he has saved the life of a cancer patient with no one else can. Okay, because he's the only match for the donor and there was no one else. Usually, being a small registry, we don't find any matches, first of all, with most of the patients. Fortunately, if we find a match, we might find only one match for a patient. So that donor is the only hope for that patient. So they can really, feel proud about it that, he was probably the only one in the world who has cured that cancer. Yeah, of course, always when you register, we hope that you register with a commitment saying that, you are registered with us. It was a simple saliva sample and nothing more. And you might have forgotten after 10 years also that you're registered with us. Doesn't matter. We'll always give you a counseling whenever you're found as a match. But of course, we would like you to step forward the day you get a call, because it is very important that, you come forward. As I said, registry is very small. There are no two donors for one patient. There is only one donor always. So finding a matching donor itself is very difficult. And even if that one donor backs out, because it is his choice. So if it backs out, it will be very sad for the patient, the relatives, the doctors. Many people are working on this one case, always. So we'll be happy to know that the donor is committed. So the emphasis is that register with a long-term commitment. Yeah. So our registry is 50,000 donors, strong or weak, I don't know, in the last 12 years. Compared to other registries, we are a very, very small registry. But nevertheless, the matching probability compared to other registries has been very, very high. We have done 18 transplants in our 50,000 donors. So that means that there were 18 patients who were definitely going to die, who were found as a match with a donor, and their cancer is completely cured. And they are all doing very well. The transplants have been done in the last 10 years, and the success rates are very, very high. So, as I said, we get about 10 patients every day looking for a matching donor, but finding a match is very, very difficult. And I see that the donors who come forward when they are found as a match are very, very willing to come forward when they know that, they've been found as a match with an end-stage cancer patient and they have very few days to live. And they are all very committed. In fact, we take time to reach out to them. The donors start calling us that, hey, what is the next step? What is the next step? So we're happy to know that. And we were very fortunate to, help 2 international patients also. Because, this is a point to be noted, because our DNA is such that, it's kind of race specific. We will match with someone from our country only. Okay. It is very rare that we'll find a match in an outside country, because our race is different. We are Aryans, Dravidians and all. American patients, Caucasians, Mongolians and all, we don't match with them. Although all registries are globally connected, we are very friendly. We are willing to help each other free of cost, but we don't match with each other. So that's the sad part of this. So every country should have its own registry with their own ethnic donors registered with them. Still, we found 2 donors for international patients. So, and it is our responsibility, if the patient is far, that the donor need not travel. The donor will donate at his location, and it is our responsibility to take the product and reach it out to the patient. So we have special privilege and connections with all the authorities from the government who have given us full support to transport the product free of cost and within 24 hours, because these are life-saving cells, something like a green corridor. So, and donors, as I said, they are so committed that we were in the middle of the pandemic, and at that time we found a match. One donor came forward in June 2020, where it was still the lockdown, and donated his stem cells in a hospital scenario, which was a COVID hospital actually. The donation took place and the patient has been benefited. It wouldn't have happened. The patient wouldn't have survived if it wasn't for this donor who stepped out in the pandemic. So as the registry, we have some regulations to follow. You should be associated with the World Marrow Donor Association. It's a governing agency which controls all the registries around the world, so that they govern us, they inspect, they do audits to see if we are functioning in the proper protocol. And we have a registered number, ION 4131, and it's called WMDA, World Marrow Donor Association. And the donors on the MDRI database are enlisted anonymously in the international database also, so that if the patient is looking for a transplant and it's an urgent basis, the doctor can directly look up on the WMDA and look for a match where he is exposed to all the donors around the world. Hopefully he'll find a match somewhere. So it is also associated with DKMS, which is a German registry, which has a very high number of donors with them, and who are willing to help us out of it. And the special privilege from German registry is that, Indians and Germans, we come from the same race, Aryan race. So our DNA is specific, that, kind of similar. So we tend to match more among the German population rather than the American population. So we associated with them also. Yeah, so our first matching donor, we started registering from 2009, but our first match was in 2014. And when we had only 14,000 donors registered with us, although the probability is 1 in 20,000, we were very lucky. Within 14,000 donors, we found our first match. Our first donor was just a 19-year-old girl pursuing college, who was very busy in her exams and all that. But nevertheless, she always was very willing, and she came forward and donated the stem cells, and the patient received it within 24 hours. And the patient is doing great. Yeah, so we have a good support from everyone around the country. Like, the product might be collected in Mumbai, the patient might be in Chandigarh, and it has to be flown by air. And the property of these stem cells is that it cannot be screened on an X-ray, which is very mandatory in all the airports. This is one challenge for us, that we have to convince the security that you cannot screen this box. And of course, we have special clearance. We have a special card saying that I am a bone marrow courier, and they give us priority of screening the courier, but not the box. And the airport, the police, the government agencies, the airlines, and the transplant doctors all have been very cooperative in getting the product across within actually 16 hours. So that's how it works. And of course, the donor's family and the donor himself have been very kind to come forward and donate for the patients. So how does the events take place for the MDRI to organize registration of donors? So flow of donor registration in the MDRI is due to the several events which are held by MDRI on a regular basis. We hold camps. We hold camps in colleges and corporates only. The reason to limit it within colleges and corporates is that the education level should be high, so that we can reach out to the donor, and they can respond by an email if they are not accessible on a phone call or something. So we would like them to understand this whole process also. And MDRI donor registration drives, which are usually follow the awareness session. That is very important. All of them should go through the awareness session to know the importance of stem cell donation, because it is not like a blood donation that it happens on the same day and it's done. The donor is committing that he will come forward on some later date. So awareness is very important. And of course, we hold fundraising drives because we don't have a government support. So we look for fund from philanthropic donors and whoever want to help us raise the register. Yeah, so this is some pictures which I've shared how the awareness session takes place. The awareness session is very informal. On an office, we take it to the floor where I stand just in the middle of the crowd and start talking, and it becomes very interactive and very interesting. I think this is the best way to approach all the donors, and we give them some time to decide and then come on a later date for the registration process. The registration process is a very simple process. As you can see on the right, we take a saliva sample, and we used to take blood samples also. So that's the bottom image shows students registering themselves with a band-aid on their arm. And last image is again a swab collection. We have huge crowds in colleges where they stand in huge serpentine lines to register themselves as donors. Yeah, so this event was organized by Tata's with the government of Nagpur And we had a huge, with Nagpur Medical College, the government medical college, we had Mr. Gadkari and Girish Mahajan coming forward to do the ribbon cutting, because in Nagpur we had a lot of patients of leukemia and sickle cell anemia, which is again a blood disorder which can be completely cured by a stem cell transplant. So this was like a community-based camp we had organized, and most of the donors who registered with us were the medical students from the colleges. So they had a rally. We had a talk by Mr. Gadkari himself, who encouraged people to come forward and register themselves. Yeah, some statistics about bone marrow registries, stem cell registries around the world. As of today's date, there are 3.9 crore donors registered all over the world. Okay, and few prominent countries which I can show you right now is France, 3.5 lakhs. The Chinese, of course, a highly populated country, about 9.9 lakhs. The National Marrow Donor Program, that's the largest registry in the world. It's the US based, and they have about close to 90 lakhs. And the German registry, of course, small country but huge registry, 74 lakhs. And Anthony Nolan Trust, about 4 to 5 lakhs. And of course, as you can see, the dark blue bubble, our Indian registry, we have 50,000 donors. We are far behind compared to all the other registries. Interesting fact about the German registry is that they had a protocol that the day any individual in Germany touches the age of 18 years, the first thing he'll have to do is a compulsory registration as a stem cell donor. He can back out if he wants, but registration is compulsory. So that's how they got the 74 lakh donors so soon. Yeah, so this is our, if anybody wants to help us with funds, the registry can grow. This is our contact details. You all can, the listeners can contact Vishwa Talks if they want to more details about this slide.